A warning from health officials after a new case of measles was confirmed in Grand Traverse County. This is the first one in the county since 2014. 7 to 4's Brittany Beauty spoke to a health officer about what this means for you and me. She joins us now live in the studio with what she found out. Brittany.
Mark, this is the public health alert we received from the health department early this morning. And one of the most important things on here is the list of times and places where people may have been exposed to measles. So far in 2019, there have been 45 cases of measles confirmed in Michigan.
The 42 were related to the outbreak in Southeast Michigan, and now we have 3 total that were related to international travel.
The latest case in Grand Traverse County. We're told the individual recently returned from a trip to Eastern Europe and was not vaccinated.
If you're not vaccinated, then you're at much higher risk for getting the disease. So in a room of 100 people, if none of them were vaccinated, measles is very contagious, so that 95% of those people we would expect then to actually get measles if they weren't vaccinated.
That's why one of the most important things the health department does to try and prevent the spread of measles is pinpoint where that person may have been when they were considered infectious.
There was exposures at 4 different community sites on 5 different days total. So anybody who would have been at one of those 4 sites during the times that we list are considered to be exposed.
Here's a list of the times and places of exposure. June 30th between 5 and 10 p.m. at Walmart in Traverse City, July 1st between 2 and 5 p.m. at the Department of Human Services, July 2nd and 3rd at Munson Family Practice, and July 4th at the Munson Emergency Room. Health officials say there is no known exposure at the National Cherry Festival.
So it's really important if they were at one of those locations, so they know they were exposed potentially, that if they start to develop symptoms, that they call ahead to their doctor. Or if their doctor's office is closed and they choose to go to urgent care or the ER, that they call first, because they need to alert them that they basically will need to have a mask put on right away.
We all found things too.
Some of the people most at risk are infants, which is why the state requires daycare providers to make sure their kids are up to date on shots before they are admitted.
So if they don't have those shots taken care of and other children don't have them throughout the center, I mean, it can cause a big outbreak or a serious injury to a child.
So to try and keep the community healthy, there is a lot of communication between the health department and schools and daycares.
Every Friday I have to send a report out to them if we have any sicknesses and anything going on in our center.
But the number one thing health officials say prevents spreading disease is vaccination.
It's to protect yourself and those around you that you love and care for, your family and friends, and for the community. So we call it community immunity.
If you're not sure if you're vaccinated, the health officer says it's okay to get it done more than once. Vaccinations are available at the health department, your doctor's office, and some pharmacies. Reporting live in the studio, Brittany Beauty, 7 and 4 News.
Thanks, Brittany. Health officials say the symptoms can show up to 21 days after exposure. We're told the symptoms are similar to a cold, along with the rash and white spots on the tongue. If you have more information about measles, on our website, upnorthlive.com.